Welcome everyone. I know we're filing in, we're just at the top of the hour. As we were all just sharing with each other, happy Juneteenth. So as folks enter the room, we'll see how many folks we have today. I know we usually have a pretty big group for this learning collab. We actually have over 100 people registered for this learning collaborative. But we'll see, since it was a pretty unpredictable week, but for good reasons. We'll see how many people are able to show up today. We will be recording, or we are recording, the learning collaborative session for today. So those who are unable to join, and we're just going to wait a little while longer for folks to continue to dial in. But for folks who are unable to join, they will receive a copy of the recording. So let's just give it a moment for folks to continue to dial in. And while that happens, while folks are dialing in, what I'll do is, April, I'll just go ahead and do a quick little screen share just so folks know they're in the right place. As you enter the room, good afternoon, everyone. This is Bethany Hamilton from the National Center for Medical Legal Partnership. Hopefully you all can see on the screen that we are together on Friday, June 18th, 2021 for the Advancing MLP and Health Centers Learning Collaborative. You are in the right place today because we are in fact joining together as peers in not just medical legal partnerships, but in addressing the social determinants of health. And we're here on the very first official federal holiday recognizing Juneteenth. And you see that, yeah, we're clapping for that. We know there's a lot more work to be done in this space, and let's just hope, right, that we can continue to make progress with regard to teaching the history of Black Americans, and then also going forward to protecting and strengthening the protections for those the civil rights of Black Americans. So we're here on June 18th, the first federal holiday to recognize Juneteenth, and I hope you all stay safe, continue to learn more about this very important date in American history. We are joined by our colleagues on the HRSA National Training Technical Assistance Partnership project here. And so I'll introduce them in just a second. I continue to see folks joining in the waiting room, so I'm just trying to buy us a few more minutes here to make sure we are together for the main portion of the presentation. But as you saw in the follow-up email that was sent a little bit earlier today, we are joined by our colleagues, Maria Ryder, Alexis Guild, and Erin Blair. Myra and Alexis are with Farm Worker Justice, and we've partnered with them in the past here at the National Center to work together on expanding medical legal partnerships for the agricultural worker population. In fact, Farm Worker Justice did publish an issue brief to help MLPs better understand the population and their legal needs, and how MLP as an approach can address those legal needs. So you hear from Myra and Alexis about how MLP has successfully addressed the legal needs for the agricultural worker population. And we know that several of you are also interested in learning about the immigration law aspects. So there will be just a couple of policy level updates, or just updates in regard to like what an immigrant's agricultural workers' legal needs might be, and how MLPs can assist. I know a lot of you have spoken to folks from all corners of the country, rather, about the excitement with regard to not just the returning to a normal space with regard to public charge, but also wanting to work with this population more in the future. And then we'll also hear from Erin Blair with NNCC, National Nurse-Led Care Coalition. And what Erin's going to be talking about, we've been calling a nurse-led MLP, a nurse-led medical legal partnership, but in preparation for today's event, what Erin explained, and I appreciate, is that we really should be talking about this in terms of community-led partnerships. And so what Erin will share goes a little bit deeper and looks at the structure of a medical legal partnership. Who are you looking at within your broader community to partner with? Who are you looking at in terms of the actual MLP workforce, and really broadening your view to move outside of just the healthcare space and the legal space. So we're really glad to be joined by them today. I just want to quickly note where we've been for this learning collaborative together. So throughout this learning collaborative, what we're doing as we talk about advancing MLP is we've traveled together to talk about the components of MLP, and we selected certain areas of conversations in our Health Center MLP Toolkit to really apply these lessons learned in building the MLP the right way. We know that MLPs typically take from 6 to 12 months to really start up and build. But for those of you with existing MLPs, if you're making changes and advancing, perhaps it may take that long, right? Maybe you're diving into a brand new space. So our whole objective here through all 4 of these sessions really is to give you some context about how to advance your MLP, how to look at specific challenges and needs to better screen and address the legal needs of these populations, how to establish those consistent and sustainable sources of funding, or how to look at better ways to utilize an expanded workforce to build your MLP and address the needs of the populations that you're serving. What I mentioned were the conversations that we talked about from the MLP toolkit. And so today's focus really is on, for Myra and Alexis, we're tying their lessons about MLP for agricultural populations in conversation number 1 from the Health Center MLP toolkit. What social determinants of health problems do we want to address? And as a part of that conversation, you're also talking about the populations that are served. And then for what you'll hear about from Erin Blair is more so tied to how are you going to build it and serve and provide the services? How are you going to contract? And then that's in addition to integration of legal services, right? Because we really are in MLP bringing the legal services into those healthcare or other settings, as Erin will explain when she begins to present. Since we are on the final session, and we did pick up a lot of registrants for this learning collaborative along the way, so some of you are new and you weren't on this first part, let me just remind us, when we talk about MLP, we're not just talking about those direct legal assistance services, right? So where the lawyer provides the counsel and advice or representation. We're talking about a spectrum of services that also helps to really build the knowledge and capacity of the health centers, since that's what we're focusing on in the Learning Collaborative, the health center teams. We're also talking about clinical level changes that can be made, where you might be looking at an entire EHR data set to say, what does the EHR tell us about the social and legal needs of a population? And maybe your lawyers are able to, or your legal expertise professionals is how I'm going to start talking about this, are able to come in and say, this social need that's popping up in your EHR data set is really indicative of perhaps a housing condition that's leading to asthma attacks that have been something related to mold that's unaddressed, for example. And then finally, you know, way up the spectrum here are the policy level changes, because this is where we see the opportunity to go from the patient level all the way to the greater population level changes through policy level change. Those are the systemic changes that we continue to hope to see, not just in addressing lead or housing issues, as you all may have tuned in on Wednesday for the eviction crisis town hall, but there are other issues we can continue to address here with regard to health equity. We hopefully as MLPs can begin to show what we're doing with climate change and environmental law. Get ready, right, to show off what you're doing in that regard. And then for the population served, such as what Myra and Alexis will be addressing, our agricultural workers. So I'm going to stop sharing the screen so that we can get to hear from the experts today. I want to make sure that our mics and everything are ready to go. I think Myra and Alexis, were you going to go first? All right, let's check to make sure your screen can be shared. And folks who are joining today, we are a smaller bunch. And I'm glad, because again, it's Juneteenth, and that means there's obviously some recognition going on across organizations. So please, first and foremost, as others have begun to do, because you may have missed this when you logged in, type in who you are and where you're from. Tell us if you have an MLP. And along the way, what we'll do is we'll see our colleagues from the National Center, April Daniels and Danielle Rahajasan are both on, and we'll begin to run some polls. So we're going to be queuing you up to answer some polling questions, and so just get ready for that. Also, before Myra jumps in, let me just note that Myra, Alexis, and Erin, we are all on this HRSA grant together and very used to not just presenting, but also pinging you all so that you can unmute and ask questions. This is the trio that is going to pose questions to you and expect you to engage and interact. So folks, get ready. First poll is on the screen. Let's give Myra, Alexis, and Aaron a sense of what type of organization you work in. So just take a moment. Myra, just confirming that we can see your screen just fine, and that April's running that poll, and we'll get a sense of who the audience is today so that you all are able to best tailor your remarks and engagement with folks. All right, so as expected, we have a lot of people from the legal services world, you know, at the National Center. That's who we typically engage most, but I'm very happy to see, this is probably Shannon tuning in from the HCCN, we have a PCA, and then Health Center folks on the line. So thank you all for joining us today. We'll continue to run polls. Myra, go right ahead. We can continue with your presentation, and thank you both.
Thank you, Bethany. Hello, everyone. As Bethany said, my name is Myra Ryder. I'm Health Programs Coordinator with Farm Worker Justice. And today my colleague Alexis and I are here to talk a little bit about MLPs for agricultural workers. And this quote here comes from our Medical Legal Partnership Guide, which Bethany referred to earlier, that was published last year. And it says many agricultural workers experience issues that are both medical and legal. And often these issues are closely connected. A medical legal partnership encourages a multidisciplinary approach to agricultural worker health and safety and creates powerful cross-sector solutions. And because this is a population that often has difficulty accessing services, having this partnership between health centers and legal providers makes services accessible to them that otherwise, because of their income, their location, language barriers, and so many other difficulties they face, they might not be able to access. And here, just to look at some of the most common legal issues faced by agricultural workers, we often see that at work, they face things like violations of labor, environmental, and occupational laws. In other spheres of their lives, they can have problems with substandard housing conditions. Sometimes they are improperly denied benefits that they should qualify for. They might face illegal evictions, racial discrimination, human trafficking, and problems related to their immigration status. And I'd just like to point out, there are some bills making their way through Congress trying to address some of these immigration issues by potentially providing a pathway to citizenship for agricultural workers. So it's just something to keep an eye on, because this may be a sector of the law that may be in flux over the next few years, depending on how these things develop in Congress. And we should keep in mind that agricultural worker rights differ greatly from state to state. Even in federal law, protections for agricultural workers are different from those for most other workers. And then on top of that, you have that different states give workers who are in agriculture different rights depending on where you're located. And then we have the issue of H2a agriculture workers. These are foreign workers that come to the US mostly from Mexico and Central America, and they are here on temporary non-immigrant work visas. So they are legally in the country, but they are not on a pathway to immigration. And these workers can stay in the US up to 10 months under the terms of their visa, sometimes less. It depends on the length of the work contract, but they can be here for no more than 10 months out of the year. They are also not able to change employment without authorization from the government. And they have to rely on employers for things like housing and transportation, sometimes even for their meals. And on top of that, many of them are hired by farm labor contractors who act as middlemen, not hired by the growers themselves. This helps shield growers from liability, but at the same time, it creates an environment in which employer abuses become common. Things like wage theft, poor working and housing conditions, employer retaliation against workers who try to defend their rights. And this creates another set of legal needs for these workers. And now I'm going to hand it over to my colleague Alexis, who's going to talk a little bit more specifically about the challenges and best practices for MLPs serving agricultural workers.
Thanks, Myra. My name is Alexis Guild. I'm the Director of Health Policy and Programs at Farm Worker Justice. I also put into the chat while Myra was speaking, she referred to the Farm Workforce Modernization Act. So I put in a link to a fact sheet that we developed at Farm Worker Justice about that proposal if you're interested in reading more about that. I also included a link to an interactive map on employment laws. As Myra mentioned, the coverage for workers kind of varies state by state in terms of workers' compensation and wage protections. So all that information is in that interactive map. So I included a link to that in the chat. So as Myra mentioned, agricultural workers have a lot of legal needs, both due to their immigration status, but also their living and working conditions. And medical legal partnerships are fantastic ways to address those needs, but there are a lot of challenges. And I will say that in all the time we've been working with legal services organizations and working specifically around the issue of medical legal partnerships, these are the challenges that come up time and time again. And, many of us, when we talk about a medical legal partnership, think about a more traditional medical legal partnership where there may be an attorney or a paralegal inside the clinic. What we think of as kind of a fully integrated medical legal partnership, but due to the unique conditions of farm workers as shared by Myra, there are additional challenges in order to make sure that there's a medical legal partnership in place. One is staffing. And I'd be curious actually to hear, as I kind of share these challenges, if any of you are in agricultural worker communities, and if you have engaged in a medical legal partnership or are trying to engage in a medical legal partnership, and what challenges you have encountered while trying to establish that. But what we've heard from many of our partners is, staffing is a huge challenge, especially for agricultural workers. Their work is seasonal. Workers either may migrate and follow the harvest, depending on their status and their wages, and depending on their family's needs. Others tend to live in the community and work in the community, but only actually work in agriculture during part of the season, and then work in other industries such as construction and landscaping during the off season. And that means that outreach workers and community health workers, the promotores, also work seasonally because they tend to have more staff while there are more workers in the community, and fewer staff when there are fewer workers in the community. So that fluctuation in staffing makes creating partnerships really challenging. And it also creates challenges around continuity, because there does tend to be a lot of transition, and staff tend to come in and out. So it's challenging from year to year to have that continuity with the various staffing challenges that occur around the seasonality of agricultural work. One that I think really needs to be thought about when thinking about medical legal partnerships is working with the employer. So I saw that many of you are from legal services organizations, and there are a few health centers as well. And legal services and health centers, everyone has the same goal in terms of helping the patient population, ensuring that they are able to be healthy both in their working conditions and their living conditions. And that's really what a medical legal partnership really tries to do. However, in farm worker communities, for those of you who work in health centers, the relationship with the grower allows the health center access to the worker. And it's complicated by the fact that for legal services, of course, they are looking to protect the rights of workers. And sometimes employers don't really like to have legal services around. And having that relationship with the health center, with legal services can complicate that relationship. So that can be a real challenge in terms of trying to establish a medical legal partnership when, especially for the health center, they are also working on trying to have good relationships with the employers in order to access those workers and provide them with health care. And then, of course, funding is a huge challenge as always. The other employer piece is that workers, of course, because there is this uneven relationship between workers and employers, and as Mara shared, for H2a workers, especially who are here on the US on employer-provided visas, they may not really be willing to talk about their legal needs because they're worried about any retaliation from their employer. So it really kind of, it requires a relationship between the worker and legal services in order to ensure, and the health center to ensure that the worker feels comfortable enough in order to share any legal needs that they may have. Next slide. So how can we overcome these challenges? And there are many different ways that agricultural worker medical legal partnerships have been successful in terms of trying to promote and try to ensure that farm workers are empowered to assert their legal rights and to be able to have access to various benefits in terms of their legal needs. So some of the best practices, of course, are best practices for all medical legal partnerships, developing goals jointly together to ensure that it is that it works for both the legal services and the health center, diversifying funding, tracking outcomes, enlisting support from students, and establishing points of contact, especially for agricultural worker communities, establishing points of contact for staff who are year-round staff as opposed to seasonal staff, because again, there's that seasonal transition. Of course, tracking resources. Many medical legal partnerships in farm worker communities look slightly more informal. So for example, there are medical legal partnerships that focus on referrals and are really based on coalitions, and they come together and they do not only training together around needs, but then they also provide referrals, and they also do joint advocacy at the community and the state level. So that's a really common type of agricultural worker medical legal partnership. We've also seen medical legal partnerships that focus on specific issues. So for example, in California, there are medical legal partnerships that focus on workers' compensation issues, and medical legal partnerships that focus on ensuring that pregnant farm worker women are able to access benefits so that they don't have to work and be exposed to pesticides while they're in their late trimesters, and that therefore they can be safe and healthy, and their baby can be safe and healthy as well. One thing to keep in mind is that for some legal services organizations, they do have restrictions in terms of funding. If they receive federal funding, if they are LSC funded, then obviously they can only provide services to lawfully present individuals and not able to provide services to undocumented individuals. H2a workers are workers who can be seen by LSC funded organizations, but there are also many organizations, as all of you know, in legal services, who serve both populations. And in many farm worker communities, there are organizations that work hand in hand with health centers and other community-based organizations, and therefore they can see both the undocumented and the lawfully present farm workers in their community, and they work together to ensure that their legal needs are being met and their healthcare needs are being met. Next slide. So we have a lot of resources. I shared the link to the map in the chat. I also can share a link to the Medical Legal Partnership Guide that Myra referred to. And we can stop there for some questions.
Yep. So one of the questions that you actually posed, Alexis, to the group, and this is where I'm going to ask folks, unmute, since we are a more manageable bunch today. So rather than putting it in the chat box, one one of the immediate questions Alexis posed to the group is she'd like to know more about your work with agricultural worker population. So whether you're a health center or from legal services, are you working with agricultural workers? And then are you working with them in an existing MLP? Are you referring folks for legal needs, addressing their legal needs through legal intervention? So let's unmute and share. And what I'm also doing, Alexis and Myra, is I'm looking through this group. And just so you all know, Aaron Blair actually also worked previously with agricultural workers, also in California. So Aaron can similarly chime in. But I'm looking for at least a couple of the individuals that I know signed up for this learning collaborative with that particular interest. We may have caught those folks on the wrong Friday. On the right but wrong Friday.
Yeah, that was like, getting my associate's degree volunteerism, but it was really interesting. And I so many of the challenges you were talking about really resonated with me, especially, and they're challenges that we have at our nursing legal partnership too, which is keeping track of the I always say families you're serving, but the clients that you're serving. Can be really challenging when you have a transient population and very relatable.
Mm-hmm. I see a comment from Rochelle. Rochelle, do you mind unmuting your mic so that you can ask that question aloud for the group?
Sure, I'd be happy to. Good afternoon, everyone. Rochelle from Wisconsin. I'm new to the MLP space, but I work with the Primary Care Association. So we have a MSAW designated health center here in Wisconsin that provides a lot of patient care for folks who work in the dairy industry. So I'm trying to understand, how do you get started, or what, are there tools for like a readiness assessment to understand, are we in a position to start doing this work? How do we assess if maybe we're duplicating something that someone else is doing? Just what are the questions to start with there, specifically for serving, an MSAW population, for example? Thank you.
No, thank you, Rochelle. Alexis, do you want to kick off first? Because I can give the National Center's perspective, and then Myra and Aaron, if you want to chime in, I can definitely give them a National Center perspective about where to start. And then Learning Collab, so others who've been there and done that, please do add your take as well.
Yeah, I was actually going to have Myra kick it off. And then I was going to add to what she shared. So Myra, do you want to take a first stab at the question?
Sure. So one of the first things that is recommended for health centers that are trying to establish a medical legal partnership is, first of all, try to do an assessment of what the community needs are in your area. So what are some of the needs that you're seeing among those agricultural workers or other population that you're trying to serve? Take stock of your own health center's capabilities. And when you identify, who could be the possible legal partners, take stock of their capabilities as well, just to see, what issues are you able to tackle? Do you focus on one issue, like Alexis said, some of these do? Can you tackle a broader variety of services? And in addition to that, in some of the large agricultural areas, some of the legal aid organizations have dedicated farm worker units that specialize in addressing farm worker issues. And they can be perfect partners in this kind of collaboration. And, it's all about setting goals and, make sure that the capabilities are there. You can always pilot an MLP for a period of time and then reassess so that you can tweak it and make changes as you go on to make sure it's sustainable and to make sure it's actually addressing and achieving the goals that you want.
And Alexis, I think you wanted to follow up on that.
I think Myra said everything. And it's about flexibility
Right.
as well.
I will add, I plugged, while Myra was explaining this, this is right in line with what we explain in the Health Center MLP Toolkit. So for those who might be in a similar position to Rochelle, where you're very much at the beginning, and I'm gonna just take liberty to, let's see if I can actually make this screen share work. I'm gonna do another screen share. But if you all click on that link to the Health Center MLP Toolkit, it will open up, and then you'll click on the image and you'll be able to open the toolkit right away. Let me see if I can get a screen share going here. Part of what the toolkit does, Rochelle, is it walks you through exactly where to start and those essential follow-up conversations to have, like what Myra explained as a first step, which is you'll want to, first of all, assess what the social, hopefully this is showing up in any way that makes sense here. But one of the first things you'll want to assess is the social needs of the patient population. And so the toolkit like really is, it's divided into 4 parts, but there are 9 essential conversations to have. And when we kicked off this learning collaborative, but also when we kicked off the year, in the fall, we walked through the toolkit's conversation very first and foremost, look at the social needs and start to make decisions with regard to, are we going to address all needs for everyone in the health center population? Or if you're not a health center and you're tuned in, maybe you're a different type of healthcare provider, or as Erin will talk about, like if you're doing in-home services or you're somewhere in between, right? It's still an essential question to ask. And it can change. It's perfectly fine to design your MLP. Maybe you have a coexisting MLP, right? Maybe you're running 2 MLP programs. One is all needs, all people in one location. And for your other location, maybe it's specifically focused on farm workers and agricultural workers. And maybe for that population, you're deciding that their priority need is workers' compensation. Or as Myra presented the other day on a different learning collaborative we do together, it's that population, but pregnant farm workers, because they are at risk because of the type of work environment that they're in, and pesticides posing a risk. So the toolkit walks through, in not just the 4 parts, but within the 4 parts, the 9 essential conversations to have. When Erin starts to present, she's going to be presenting on one of those other crucial conversations, which is how to build it. In the toolkit, we frame the how to build it conversation around deciding if you're going to contract for the legal services, or I think Alexis was the one who talked a little bit about how some health center MLPs have it totally integrated, such as Whitman Walker. I think Crescent Care also down in Louisiana is totally integrated. And there are actually health centers that work with farm workers in California that are right now reaching out to us for assistance on how to like fold it all in together and better and integrate it. I will note that the reason folks are thinking very hard about that is related to what you all heard, like Shannon, Mallory, and others present on, and I believe because we have 2 running learning collabs here, session 2 together, or maybe it was session 3 for this learning collab, but you all heard Mallory and Shannon and the folks between Iowa working on exactly that, closing the loop on a referral project. MLPs are about much more than just sending out referrals to legal services. It is about actually intervening and providing that legal service to address that person's legal need. But then go one step further, right? The folks who made the referral on the healthcare side could very well be find useful the information about the legal intervention and how it ties back to the outcome, right? So that's what you heard about from that prior presentation in the session. 2 or 3, I'll get that down right. But the point I'm trying to make is that it is about much more than just making referrals. So to Rochelle's question, where do you start and how do I assess whether or not the health center is ready? These are the sorts of things you would look at. You could look at your data sets, what it currently tells you, and your ability to transfer and share information so that you can do much more than a referral, but can actually track the interventions and whether they are indeed and how they're tied to the health outcomes. So that's what I'd add, but Myra is absolutely right. Mm-hmm. Those are just some additional tips.
Just one shout out. So I saw in the chat, Steve Weiss was sharing about the Monterey County Medical Legal Partnership, which is California Rural Legal Assistance and the Monterey County Health Department. And we actually have featured them in multiple webinars, and also they're featured in the Medical Legal Partnership Guide. They do a lot of great work in the Salinas, Monterey County area, which has a large agricultural worker community. And actually that project around pregnant farm worker women is actually the Monterey County Medical Legal Partnership. And so it looks like they're hiring. So if you want to live in Salinas, it's a salad bowl capital of the country. So certainly encourage you, if you're looking for a change, or if you know of legal services folks, to head over there. But they're a great model as well for a fully integrated medical legal partnership, but also medical legal partnership that kind of is also looking at, one specific issue and kind of figuring out, not just on the ground, kind of how to make sure that they have access to those benefits, but also from a systemic policy angle, and how can, policy play a role in terms of being able to ensure that farm worker women are able to protect themselves and their unborn children, and then their young children from pesticide exposure.
I picked on Steve before to unmute and share more, but we're familiar. This is the second time. Steve, you have no idea that MLP has come up twice now in learning collaboratives. So we've covered it, but feel free to chime in. We'll transition to Aaron though next, if that's okay with folks.
I just wanted to ask Steve whether or not he's partnered with his local nurse family partnership or other maternal child health home visiting programs in the Salinas and Monterey counties, because that would be a great way to, if you have educational sessions on those rights and stuff like that, educating the nurse home visitors and their staff about the existence of those rights would also give you more connection to the community that you're trying to serve.
Oh, I'm not with CRLA. I'm in the Bay Area Legal Aid. So I'm not certain about their connections, but I did put a link to one of their reports. I'm just familiar with their work.
Okay, thanks, Steve. Sorry, sorry about that. Steve, you were about to say, and we.
I was just going to say, our MLPs are more traditional with community health centers and behavioral health partners, so we don't have the relationships that you're talking about, but certainly are interested in seeing if we can develop those.
So Steve's definitely been doing MLP longer than I have. I just want to make one note about what Steve mentioned about traditional. For the MLPs, they are very much like the health centers, right? 1,000 flowers have bloomed, and they bloom in all different colors, sizes, and shapes. And so how you all started now, and there are a lot of folks who've been doing MLP on here who have been around for a long time doing this, and are some of the folks from the founding movement. So Ann Mangiamelli is on here today too. She's in Nebraska, and I would totally recommend that you all reach out to folks like Steve, and there are several others. But what you decide to do with your MLP is perfectly fine, even if it looks completely different from what Steve or Ann are doing. And even what you see the National Center or Farm Worker Justice highlighting, or NNCC, what Aaron's going to talk about in a second. So I'm just going to push you all to be innovative, creative. Steve and Ann may come on a year from now and say, yep, we totally changed things up in some way, and we're going to highlight them anyways. So, all right. Aaron, you're up next. Let me make sure your slides can show. And then I think we have another polling question. April, do we have another polling question that we want to run now, or in the moment? All right. We're sneaking in some of our surveying information. So based on the information that you all have received thus far today, tell us so far, and this is to date, especially if you've been in all sessions with us thus far, please begin to help us gather information for HRSA about the effectiveness of these trainings information you're receiving from Myra. Alexis will receive from Aaron in a moment, and then our previous presenters, such as Dan and Andy on justice-involved populations, Mallory, Shannon, and their colleagues on information sharing and closing the loop. And it sounds like people are pretty confident they'll be able to use this information. Aaron, I suppose with that, the pressure's on, but I have no doubt you're going to be able to meet expectations and give them information they're similarly going to be able to apply to their MLPs. So all yours.
I was going to say mostly concerned about technology issues. Hold on.
Hey, you're okay. You're okay. I had the technology issues before we all logged in. You're good.
Beginning. Okay. Hi, everybody. I am Erin Blair. I am a Bachelor of Repairs registered nurse, and I have been a nurse home visitor with the Philadelphia Nurse Family Partnership for 13 years. Our organization is going to be celebrating its 20-year anniversary on July 1st, which is super exciting. But I also work with another maternal child health home visiting program called the Mabel Morris Home Visiting Program. I am gradually exiting my life as a home visitor, and I am for the last 5 years, I've been the nurse liaison for our nursing legal partnership, which is a fully integrated medical legal partnership into our nurse home visiting services. This is the team that I work with. I work for the National Nurse-Led Care Consortium, and we really wanted a nurse-led model for our medical legal partnership. So we have always had a nurse that's been on the core staff that has experience with home visiting and with the population we're serving to kind of act as the liaison between the nursing staff that's doing that's gathering the information and doing the legal screenings and the legal staff, so that we're able to facilitate better consultations between the legal staff, identify what educational needs the home visiting staff has, and making sure to meet the broader community needs with our policy and advocacy work that we do that's derived from our clients' voices about what they need, which we try and center in everything we do, and then also from the direct legal, what we're seeing in the field and what referrals we're making to our legal partnership. So I think I probably already said some of the things that are up here, but we serve about 800 plus families in every zip code across Philadelphia. Nurse Family Partnership serves low income first time moms who have not previously parented. And the Mabel Morris program serves families with children up to school age, which may be 5, 6 years old when they enter kindergarten. I can't see my screen. Hold on one second. We have 3 prongs to our care, which are we offer training to the staff and training to the broader community, individual representation to our clients that we serve through our home visiting models, and we do systemic policy and advocacy work. What we found is that public civil legal aid lawyers and public health nurses are kindred spirits. We see the world very much alike, and we see holistic approaches to matching families with their resources that they need. As folks in the medical legal partnership world, you probably recognize that a lot of legal needs are intertwined with non-legal needs. So we make sure to have a robust resources navigation team that assists our nurses. So one of my roles as the liaison is also complex case navigation from the nursing perspective to meet any unmet non-legal resource needs that are tied into the legal services that we're providing. I also administer our emergency fund to meet any financial needs that families have that can't be met through legal services or our home visiting model alone. This is just to give you an idea of what our services look like. What our services look like from June 1st of last year to May of this year, because last year was, it was a lot. So we typically, the numbers hold steady though. We typically have, 500 or more legal service needs that we address per year through either consultation, education and training, or through direct client services. Last year, we had a little bit of a bump, and all of our legal team became experts on unemployment compensation. as I'm sure many of you did as well, and various other changing things. One thing you might notice there is that our legal immigration status, you can see number of cases 0, number of consults 9, and total matters 9. So because we don't have the immigration and legal status information, we partner with community partners and they partner with us. So we'll get referrals for families to be served as parents by our organization, and in return, we refer our families to them. And we really, really appreciate bi-directional collaborations, bi-directional partnerships, and bi-directional learning from each other's organizations. We feel like that strengthens the legal services community and it strengthens the services provided to the families. And we can discuss together as a group in Philadelphia where we're meeting the needs and where we're missing the marks. And when we're missing the marks, is it a policy need? Is it a communications and outreach need? Is it like, what is the right way to approach that need that's going unmet? Or connecting with the right people that need the service that may not know of its existence. This is just a quick quote from one of our home visitors. And the MLP has had a dramatic impact on the families I serve in my practice. I am better equipped to identify legal needs and other related issues and to assist them in first steps to support them in resolving their needs. I also feel the education and direct legal support from the Nursing Legal Partnership has decreased my own vicarious trauma and prevented me from burnout. And so some of the most interesting statistics that we've had through the 5 years that we've been doing our NLP is that the support of our legal partnership has decreased the burnout of our nurses. And public health people that do home visiting and are faced with the lives of the families they serve. And, you know, when you're, as a home visitor, you offer information, resources, and supports to families over and over again. But the system is so broken that it just feels to them like you're sending them into a dead end after a dead end after a dead end. And that can really impact the trust in the relationship that you have with a family. We serve our families for 2.5 to 5 years. And so breaking down that trust can really break down your ability to serve a family through the whole program. So a lot of our clients cite the NLP as something that also helps them stay connected with their nurses. So it really is like the services are really integrated. They're really beautifully dovetailed together. And the legal partnership not just supports the nurses in assisting their families, it supports the nurses in their own self-care and mental health, because we're not trying to be lawyers, because we're not. But boy, did I spend the 9 years before they came trying to be. Oh, I don't know how to go back. Does anyone know how to go back?
You want to go back a slide? You were trying to go back a slide?
There we go. I found it.
Yeah.
So this, I just threw in a couple pictures because I like people to see pictures of the families and the team that I have. We have about 40 nurses. Each nurse serves between 12 and 25 families. And so our legal service partners serve every one of those families. We also continue to serve families if they already have a legal service that's open. When they graduate with the program, we will continue through until that legal service, that open case has been resolved. One of the ways that we center our families' voices in our legal partnership and in the work that we do is through a community action day and our nurse-led policy team that partners with the civil legal aid attorneys. So on Community Action Day, we invite community partners out and we invite all the families that we work with out to tell us what change they want to see in their community. And we've used that to build a 12-point policy agenda that guides the work that we do when we're reaching out to legislators to let them know what maternal child health needs to look like and what the city needs to look like to support families in thriving. And this is just some pictures from our 2019 Community Action Day. The 2021 was more of a screenshot of a Zoom. So not quite as exciting. And that's the info that I have. And that's the slides that I have. But I think something that's, I've a lot of medical legal partnerships are center-based, and so the families are coming into the center and receiving care there and getting connected with services. And for anyone who's able to develop partnerships with referral partners that are actually in the home, I think it really expands your ability to provide services, because you can see, you can physically be there, you can take pictures of the housing issues that are occurring, you can see how it's impacting the families. But you can also, I think, being in the community, you see impacts in a way that I find that very often my clients don't know they're being impacted by something. And so when to ask somebody to do a screening in a doctor's office, they'll say, no, 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 no. But when you're sitting in their house and they say, no, 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 you get the opportunity to say, let's talk more about that. So last time we met, this is what I heard you say. And so can you see how I think there might be some support for you around that issue? But very often, a lot of low resource people that have been abused by systems forever have a really hard time identifying that they have unmet needs because they've never been met before. And that's just an unfortunate condition of the society we live in. And so they have frustrations, but they don't recognize there's supports out there that might be able to remedy those issues or at least assist them. One of the other things we do is partner with all of the maternal child health programs across the city and invite them to our trainings so that they can benefit from learning how to screen families for legal needs and refer them for supports as well. And that's been a really, really good way for us to put ourselves out there as kind of policy and advocacy experts and get nurses invited into conversations where they wouldn't normally be present, to get community health workers into rooms that are traditionally for senior management of, the Office of Homeless Services and things like that, where they're not out in the field and they're not seeing how things play out in the communities they're serving. And so for people who are expert in delivering care in the community to be able to be present and have a voice at the table to represent families' needs is imperative to pushing policy forward. I think that's sort of what I have. Does that work?
Yeah, I was actually going to jump in, Erin, and see if folks have initial questions. One of the questions I think we wanted to pose to you all in the Learning Collaborative together, because we are in fact peers. Erin is one of your peers. As a nurse, Erin, it might be helpful to know who else is a nurse on the line here today. I know, for example, Shannon, who presented in the past, is a nurse, and she's at the H2CN and worked directly on that closing the loop to referral process. And I know we had another nurse who has been with us through all of the sessions, who's at the very beginning of MLP development. And I'm not sure if she's on today, but she's out in the Southwest area of the United States and has a very unique population. I don't know if she's on here today, but she may or may not want to speak. If she's not, let me just do this for the sake of the recording for folks who will view later. Erin, is there a place to start for those who are nurses and might be just at the beginning of their conversations on starting an MLP? Any specific advice for them, in addition to I think, a super helpful tip about the impact on the workforce? Any specific advice for the nurse workforce?
I think that one of the most important things that is having nurse leadership as part of the team. I would just say having experienced nurses that are able to inform legal partners about like the nursing side of things and be able to monitor kind of the health outcomes of the social determinants of health related needs you may be serving. I think allows you to kind of create better impact statements and better return on investment reports and things like that in a way that investors understand and want to commit to supporting. People really like nurses. I'm, not tooting my own horn, but as my legal services partner says all the time, nobody wants to hear from another lawyer, but they really love hearing from nurses and families. I think civil legal attorneys are wonderful, and I always like hearing from you, just so you know. I would also say that like really depending on what model you have, I mean, we're a well-established nurse home visiting program with a robust data collection model. And that made that kind of integration step a little bit easier because we kind of already had the collection systems in place. But asking your nurses to do one more thing, getting buy-in from your staff to know that even though they're learning a new thing, it's going to be different. It puts a little more on their plate. In the long run, not having to crisis manage a crisis every time you're in a home allows you to deliver the actual care you're there to deliver. And that, so the initial upfront investment in learning the new program and referral and stuff like that, when it translates to your family not becoming homeless or the family not having their child lost to child welfare services or like all of those things, you actually end up decreasing the ask on the nurse because you now have a lawyer that's managing the legal stuff and an ear for the family to have to talk with about the issues and stressors that are going on associated with some sort of legal need or crisis, which frees your staff up to actually focus on the education and services that they're there to provide.
Erin, there's at least one comment in the chat. I wonder if Lauren may want to expound upon what's typed in there about being very interested in the above. Not sure if it's the information that Erin explained or what we put into the chat, but Lauren, you're interested in the above. Yeah, thank you so much.
Both from what's in the chat and what Erin was talking about. We have an MLP pilot in a NICU at Dornbecker Children's Hospital in Portland, Oregon. And so far, we've gotten really great feedback and buy-in from our nurses who are totally overwhelmed all the time and overextended. But having the legal services resources in-house, we've started to see some of this effect. COVID has been a challenge, and we're trying to kind of figure out how to take the next steps and measure that in our nurses and also in other staff, learners, trainees, social workers, physicians, so that we can get better institutional buy-in for the program and expansion of the program. So it was thrilled to hear about your experiences with that.
I think a lot of that is our education model too. So making sure that there's, mandatory or voluntary staff trainings about different identified legal needs and kind of first steps you can give so that you're kind of, we're like the triage of legal needs, right? So out in a home visit or talking with a family that's struggling with housing security, it's sort of kind of getting some ideas about what the roots of housing insecurity are, what families are actually facing, so that somebody who might be a little more disconnected from those needs on the ground actually has some of the understanding of kind of the frustrations and challenges of navigating those systems and kind of first steps somebody can take while they're waiting for a legal services referral to get picked up by a provider or picked up and carried on. And I think that actually helps as well. It's just those education really makes people understand things better. And with our nurses, certainly they feel more prepared to respond to initial disclosures of a lot of challenges that families are experiencing.
So
thank you,
Erin, and Myra, and Alexis. I lost Alexis on my screen, but I know you're there. So we just wanted to let folks know that because I don't want to abruptly end this conversation, and this is the last session that we have. So I don't know if you all have just like 5 more minutes to see if anyone has a last question. And I just want to make note that April has popped a link to the SurveyMonkey, the post-attendance survey. We just want to make sure this was helpful to you all, and we also need to know what we can do, in the future, continue to improve our offerings to you, including leaving more time for Q&A. So Myra, Alexis, and Aaron, if you can stick with us maybe just 5 more minutes in case folks have some additional questions. I'm filling in the air so that folks can unmute and share questions or comments for our 3 guest panelists today. Also, you'll see that I put the link to the Google Doc so we can indicate as MLPers if we would like to serve as a mentor, a mentee, or not that, but share some resources or receive some additional resources. So take a moment and at least open up that link so that you can indicate interest in sharing information and being supportive as peers. And I saw some more folks actually filled it out. So any additional questions?
Just to throw it out there, if anyone's interested in learning a little bit more about the National Nurse-Led Care Consortium and ways to partner with them, or interested in learning a little bit more about the model that we have there, if you go to the National Nurse-Led Care Consortium website, there should be a lot of our Learning Collaborative videos, including presentations on some of our policy and advocacy work, as well as our nursing legal partnership.
We'll share a link to that right now, Erin. Thank you. And then Myra and Alexis shared the Farm Worker Justice MLP toolkit. I keep calling it an issue brief. It's a toolkit. It's also updates are scheduled, I believe, for next year for the toolkit if we didn't just put that update out, and I could be mixing things up. I think that update perhaps just came out. So the link, Erin, we just put it in there for NNCC's MLP website. Anyone want to share from our Learning Collab participant group some parting remarks on this Friday? We are going to come back with more as all of us as NTAPs are preparing right now for year 2 of this 3-year grant cycle. So there will be more. And I'm hoping we can continue to pick up the conversation and connections as peers. You really do have some experienced MLPs in this bunch. And so hopefully, you know, the next go round, we'll hear from those more advanced MLPs about how existing MLPs might be able to continue to push forward or change what they do. And then similarly, for the newbies in the bunch, what you've been able to take from this to be able to launch and further advance your own MLP work as well. So anyone want to take us home with any closing remarks on this very first official Juneteenth? But I know this bunch, and I know we've been recognizing it for a while. I see Sue's camera. Yeah, and Alexis, go ahead.
I'll go ahead, Sue.
Oh, I just wanted to share, thank you for doing this series. I might have been the one from the Southwest that you were wondering about, but I thought, oh, I'm not sure if I am. But new to a brand new community health center in a very rural corner on the border of Arizona and Utah. And we have a great many legal needs in the area as we're finding out with our patients. And so this is what drew me to the series. But in the meantime, I've reached out to a law school to see if there'd be law students who would be willing to participate with us or use us as a project or look at an MLP, and reached out to a couple of state legal aid groups in Arizona and Utah to try to just say, okay, we need the help in a different way than I've had in my previous agencies. And so, but that was from this. So thank you. And I'm a super newbie, but really want to pursue this over time. So just wanted to throw that in.
We've got email addresses already beginning to pop up, Sue. And so for everyone, right, in Sue's position or otherwise, you can always reach out to the National Center team, as well as our HRSA funded colleagues, Alexis, Aaron, and Myra. Thank you all for joining us. Alexis, you want to take the honors and close us out?
So I was just going to share that I feel like we're in a great space of opportunity right now. I mean, thinking about Juneteenth, thinking about, the emphasis on health equity. We all know the COVID pandemic really exacerbated many of the issues that we see in populations that health centers serve, including farm workers, but then also Latinx and Black and other communities of color. And I think, medical legal partnerships play a really important role in not only ensuring that our communities that we serve and care so much about, that they are able to access the resources that they need, but thinking about sustainability and thinking about those, addressing those systemic issues to ensure that not just in the short term, but in the long term, everyone is able to live a healthy and good life. So that's just what I wanted to conclude with on this wonderful Juneteenth.
Perfect conclusion, except for let me top it off with another thank you for you all, our guest panelists, Myra Ryder, Erin Blair, Alexis Guild, as well as our participants. You all made our Fridays awesome and fun. You know how to reach us. In fact, you may not want to email that NTMLP GW account. You can email us directly and get through to us anytime. So thanks for rolling with us on Friday afternoons. We'll be back for another round. You all go, stay safe, enjoy your weekends, help people get vaccinated. Thanks, y'all. Bye.
Thanks.